This is an ultrasound study of a 32 years old male with a history of right upper quadrant pain for the last few days, and as I move the probe from the subcostal region, mid-subcostal region, when I move the probe upward, you will see the liver, and as I move the probe downwards, I see about a mass, heterogeneous mass, extending from the region of the right hypochondrium down up to the para-umbilical region in straight line. And this is a typical appearance of a bowel-related mass, that of the colon. It measures in longitudinal section approximately 8.7 into 4.5 centimeters. This is the ball. Ball is irregular and measures approximately 7.0 mm. More than 5 millimeters is considered to be pathological. So what we see is a heterogeneous solid mass giving a pseudokidney sign. We see kidney also as well, like this, and this is in fact a bowel-related mass giving a pseudokidney sign with thick walls measuring 7 mm, and these are the trapped bowel, trapped food material within the bowel. So this is an infected material within the lumen of the bowel. Patient is tended to the probe, and see now I'm going to give a sweep to the probe from the lower margin of the right subcostal region down, and here we see it extends up to the para-umbilical region, and it is a colonic mass, infective in nature. Patient is tender, is toxic, and you can see trapped air within the lumen of the bowel. This is the mass, this area, and this is the trapped bowel within its lumen. Both ends are abrupt. Lobulation is seen. There is lobulation, and both ends are abrupt. This is the medial end, this is the lateral end. See the lobulation, and this is the trapped air in the lumen. Rest, this is the, I'm going to mark it for you, the bowel mass in longitudinal section, extending from the right upper quadrant down up to the para-umbilical region. This is the transfer section of the same. Now let's see that whether it relates to any other organ or not. First of all, we should see the lower pole of the kidney. It's okay, lower pole is clear. It does not relate to the kidney. Then this is the liver, here comes the gallbladder. This is the liver, liver is normal, portal vein is okay, gallbladder is okay, no pathology is seen, no pleural seen. This is the right hemidiaphragm. Then we see the pancreas, does it relate to the pancreas or not? This is the pancreas. This white band of tissue is the pancreas, splenic vein, superior mesenteric vein, superior mesenteric artery. This is the aorta. And you can see that that does not relate to the pancreas as well. So is the spleen in line? Let's see that. No, spleen is normal. This is the spleen, as is the left kidney. This is the aorta, no para-aortic adenopathy seen. This is the urinary bladder and the prostate. This is the urinary bladder, prostate, and this is the longitudinal view. No aside is seen. This was to see if there is any dependent region site. The longitudinal view should always be take and give a sweep to the probe in all abdominal quadrant to see if there is any other satellite lesion or any other mass seen in any other quadrant of the abdomen. We do not see that. We see only here. Now the liver, it does not relate to the liver. So this is a right upper quadrant mass. However, it gives mass effect on the it gives mass effect on the kidney, as you will see on the proximal ureter rather. This is the proximal ureter, this area. This is the proximal ureter. This is up to here. And this is the pelvic region. This is the pelvis of the kidney. This is the proximal ureter. And if you see that this is the right kidney, this is the liver, and you can see that there is debris within the non-dilated, rather mildly dilated pelvis. There is debris. This is the proximal ureter. Measures for 13.4, should not exceed more than 7. So this is a dilated proximal ureter and is filled with echo along with both minimally dilated pelvis as well as the proximal ureter is dilated and filled with debris because of the mass effects on this bowel mass in the region of the right hypochondrium, extending in straight line posteriorly. And well, this is a bowel mass, and this mass is in a location where it is giving pressure on the ureter, proximal ureter, in the location colonic mass. Where is the mass? This is the mass, okay. Bowels. So this is, here we can see the pressure effect from this bowel mass having trapped air lumen within on the proximal ureter, which is dilated up to 13.5 mm, normal being 7, and minimally dilated pelvis with debris within it, because normal pelvis should have been as black as this area. So this is our case of the day. Thank you very much.